Hi everyone, I'm Susan Winograd with Pelvicore Rehab and Wellness. One of the most common questions I asked from people that have been prescribed estrogen cream is, no one told me exactly where to put it. Now here's the simple answer. Number one, always listen to your healthcare provider. This video is meant for informational use only and for you to learn how to advocate for yourself and ask the right questions. But the simple answer is both internally and externally. Think of your pelvic floor muscles like a hammock with 3 layers of muscles in it. Those muscles don't just sit inside the vagina, they attach around the vaginal opening to support the bladder, the uterus, and the rectum. Those tissues that cover these muscles all have estrogen receptors, meaning they respond to estrogen and benefit from it. As estrogen levels decline during perimenopause and menopause, these tissues become thinner, they become drier, less elastic, and just more fragile. That can contribute to symptoms like vaginal dryness, burning, irritation, painful intercourse, urinary urgency, frequent UTIs, and even pelvic floor pain. Applying estrogen cream inside the vagina to help nourish the deeper layers of the vaginal tissue is amazing. But don't stop there. The external tissues around the vaginal opening, the inner labia, the area around the urethra also benefit tremendously from estrogen. Remember that these external tissue is layer 1 of the pelvic floor muscles, so they benefit from estrogen as well. Think about it as moisturizing dry skin on your face. You wouldn't only put it on the inside of your mouth, you would apply it to all of the skin that needs nourishment, and the same principle applies here. This is how I recommend you would prescribe it, but of course, always consult with your healthcare provider. First of all, wash your hands thoroughly with gentle hand soap. Apply the prescribed amount inside the vagina, either using the applicator or your finger, depending on what your doctor told you or what the prescription says. And then either with the remaining cream that's left over on your fingertip or add a tiny bit more, massage it around the vaginal opening, the labia minora, around the urethral opening. You don't need a lot. A little coating goes a long way. Think of it as moisturizing the tissues rather than coating them. One important reminder is that vaginal estrogen is very different from systemic hormone therapy. It's a low-dose treatment designed to restore the health of those local external tissues and the deeper layers of the pelvic floor where it is applied. For many women, it's one of the most safest, one of the most effective ways to improve tissue quality and reduce urinary urgency, UTIs, and vaginal symptoms. Healthy tissues make for happy muscles. And when the muscles and the tissues are healthier, they're often better able to support your bladder, your bowel, and sexual function. If you've been prescribed vaginal estrogen, don't be afraid to use it consistently. It can take 3 months to start working, and it's one of the most simplest things you can do to help your pelvic tissue stay healthy for years to come. Remember, always consult with your healthcare provider. This is meant for informational purposes only. And if you haven't already subscribed, go ahead and hit the subscribe button so you don't miss any more amazing videos.